Hey guys, Tracy and I are going to show you how to tape an ET tube with tape, specifically for proning our patients, because the holster can cause skin breakdown when they're proned. Alright, so you actually want to have two people, preferably two RTs. You'll need, that way one can tape, one can hold the ET tube. So you'll need our special 3M tape. They use this in the NICU to tape as well. It's a very soft cloth tape. It's very sticky. You will need scissors. You cannot tear this tape. You can only tear the backing, the paper backing there. You can't tear the tape itself, so you will need scissors. So your patient will have the holster on. Before you take the holster off, you want to measure the patient. You can do two methods. You can either just tape on the face, or you can actually go around the head. I'm going to show you the first one first, just tape on the face. So you'll want to take your tape, and you'll actually want to measure from earlobe over to your other earlobe here. So you'll get where you need to cut the tape. You'll cut your tape. So you'll have slot here. And then you want to cut your second piece of tape. And you actually don't have to measure, you can just use your first piece of tape as your guide here. Alright, so I got both pieces of tape. What you want to do is pick an end, and you'll actually cut that end. So what you want to do is have an anchor here on one side. So you will cut down the middle on the opposite side that you're going to use as your anchor. So you just cut down the middle. And you'll make sure that you cut enough, since you can't tear this tape. So that should be perfect right there. It's corner of the lips right there. Tear is right there. And you want to do that with your second piece of tape as well. And then you'll do the same. Make sure you cut far enough, so that is perfect. Alright, so what you'll do, you'll have your two people. You will take the holster off. One person will hold the ET tube. The person that's going to tape, just wipe the face off with a washcloth or gauze, whatever. Make sure the face is nice and dry so your tape will actually stick to the patient's face. So once you do that, you'll actually want to tape. So you can pick a side, you can do in the middle. I prefer one of the sides just because it's a little bit easier to tape when the tube is on the side. So you will take the backing off the tape. And be careful with the tape because it does stick to itself, and when it does not come apart. So then you're going to have to cut another piece of tape. So what you're going to do, put your anchor over here. Start as close to the earlobe as you can get without actually taping on the ear. You can see this tape is actually trying to stick to itself. So you put your anchor down, you're going to take your top piece, come up over the upper lip, and go around to the other side. And make sure you don't tape on the ear. So you see this is a little bit too long, so what you can do is, before you get that down, trim a little bit. Try not to cut close to the patient's face because you can actually cut the patient. It's happened. Nothing worse than having a patient bleed. So what you'll do is take the bottom piece, you'll come up, and make sure you don't pull the tape. If you do, it can make it fold up on itself. So the person taping will take the ET tube. Make sure you do not tape your pilot balloon line when you're taping. because then you may not be able to get air in the cuff if you need to inflate the cuff.
Yeah.
Alright, there you go. You'll come around. And just drape the tape up the ET tube. And make sure it's actually sticking to your ET tube. So you'll just wrap up the tube, and when you get down to the last bit of it here, make a little tab so you can pull that when you want to change your tape. That way you'll have a little tab here that you can just pull and take the tape off. So you'll do that. Make sure everything is nice and secure with that first piece of tape. Then you'll take your second piece of tape. Take the backing off. And you'll start on the opposite side. So you will put your anchor over here. And it's okay to tape over that strap, that piece that you brought across the first time. You'll come up over the lip. And it's okay to tape to your anchor over here on this side. Not going to hurt anything. You'll take your bottom piece, you'll come up over the top lip, and you will actually want to go the opposite direction of the first piece. So you see this first piece, we went this way. Second piece, you want to go the opposite way. That way it'll anchor the tube a little bit better. So you'll come around and you'll just start wrapping up the tube like you did with the first piece. Then you'll make a little tab here. So there you go. So you have another tab where you can take the tape off. All right. So then what you're going to want to do is take another piece of tape, cut it so you can come across the upper lip and act as a securement. So you will actually have a piece of tape over everything here. So again, you'll want to measure. You can also do this before you even start taping. And you will actually need to trim a little bit, because not everybody has a fat upper lip. So you will trim the entire piece here. Alright. You'll take your backing off. And you'll just go from earlobe all the way across to other earlobe. And you'll just make sure everything is nice and secure on the face. And that is how you secure an ET tube. You can see that is pretty secure. All right.